Hello everybody, this is Penile Dermatology. I will give you a short overview on rashes, spots, ugly stuff on your penis because I know men suffer in silence, but anything red on their Johnson makes them go. So basically, we are dealing with hygiene issues, bacterial infections, viral infections, fungal infections, sexually transmitted diseases, stuff that doesn't have anything to do with the penis, but is still there, and cancer. The most common problem I see in my practice, wait a second, first things first, please subscribe to UroChannel, hit the Euro-like button and activate the bell for never to miss out on new content. Okay, there's a YouTube logo in the right-hand corner of your screen. Click on it now. Thank you. The biggest issue nowadays is hygiene. I mean, too much hygiene. There is a natural protecting barrier on the skin which gets damaged by water and soap or water and shower gels. Very often, these gels are quite aggressive towards the natural pH of the skin. If you shower several times a day and wash your penis with soap each time, this opens a window of opportunity for bacteria and fungal infections. So many men are helped by a change in their personal hygiene. Wash less often, switch to products designed for that area, apply special ointments on the penis which have a formula that is adapted to that special environment. Here's one they sell in Germany. Silly name, but I think it is excellent. If there is fungal infection in addition to that, I throw some mild steroid cream on it. Here you go. This is most patients. By the way, I'm unable to show you any pictures because it would be against YouTube community guidelines. The next category are the invisible ones. What these patients describe to me before I take a look pretty much is the description of a cancer or something similar in that category. When I examine them, I see nothing. But I try hard and maybe I'm able to see something. But when I point on that spot, they point to another one where I still don't see a thing. So nothing much to treat here. Then maybe I should talk a bit about sexually transmitted diseases. Herpes is quite common. Basically, it's itchy and burns and there are blisters on a red rash on the penis. Treatment depends a bit on the severity and the time the patients show up after it started. But generally, there is medication which is effective against herpes virus. But anyway, any kind of isolated singular wound, be it painful or not, should be sorted out by a doctor immediately. We call this an ulcer, and it is one of the early signs of syphilis. Cancer doesn't occur that often, but sometimes a biopsy will have to be taken from red spots which don't resolve despite treatment. There is one chronic inflammation of the penis by the name of Zoon balanitis. We don't really know where it comes from and it is not contagious. Typically, it affects men beyond their 50s. It is characterized by a red-yellowish discoloration on the glands and the inner layer of the prepuce. Zoon balanitis is a benign condition. Diseases like psoriasis or rashes related to drugs might also show on the penis. Generally, as a rule, uncircumcised men have more skin problems with their penis. You know, the foreskin keeps it moist underneath, which makes the skin more prone to these kinds of problems. So here's my tip for uncircumcised men. Retract the foreskin for urinating and wipe off any urine left on the glands before retracting the prepuce. In addition to that, try to keep a regimen of personal hygiene I described earlier in this video. And here's another important thing. This video is not a medical consultation. If you have any questions about your personal condition, please make an appointment with your urologist or dermatologist. Don't ask personal stuff in the comments. I won't answer to them. Thank you for your cooperation. However, if you have penile problems, you might be interested in this playlist. Thanks for watching. Bye bye.